Anti-Emetics. What is emesis?
To throw up.
So what's an anti-emetic?
To stop.
Yeah, stop them from throwing up. So this is anti-nausea, anti-vomiting. Okay. If you look up at the top right, it says adjunct. Okay. So the what does an adjunct drug mean?
To take with.
Take with. So other adjunct antiemetics, meaning I wouldn't use them as primary, but if I couldn't control it with the first drug, we can use benzos. What do benzos end in? Pam or
lamb.
Pamalam. We can use corticosteroids as adjunct antiemetics. Did y'all know that? Especially in our cancer patients, we use corticosteroids. What do corticosteroids end in? Zone or solone. Okay. We can also use antihistamines because what do they do?
A hole poker.
Well, histamine is a hole poker, but if it's an antihistamine, they dry you out too, right? Have you ever taken like Claritins or Tech or whatever, so they can dry out your stomach and make you not puke, right? Okay. With antiemetics, you need to report urinary retention. This is very important. Y'all know urinary retention is always reportable, right? Because their bladder can pop. Yes. Okay. All right, so we're going to start with ondansetron. This is Zofran. Y'all probably heard of it before. Yes. It comes PO, IV, IM. It can come as an ODT as well. That's part of PO, but I just want to make sure I'll know what an ODT is. What's an ODT?
Over the counter?
ODT.
Oh.
ODT. What is a drug that you take ODT?
Where are you seeing the ODT?
I'm not. I'm asking you a question. What is an ODT? Nobody? Okay. If you see a drug that you are supposed to give ODT, it is an oral disintegrating tablet. So they put it on their tongue and it disintegrates. Okay. All right. Ondansetron is a 5-HT3 antagonist. What is 5-HT3?
Serotonin.
Okay. So it is a serotonin antagonist. Okay. Serotonin is present on your vagal nerve. What does your vagal nerve do? I've asked this to y'all like 1,000 times. A gag reflex will initiate it, but that's not what it does. What is the vagus nerve? Y'all get out your red flag sheet. I am tired of asking y'all this shit, okay? The vagus nerve is your parasympathetic system nerve. It calms you down, it rests and digests, okay? So serotonin is present on the vagal nerve and in the CTZ. What's the CTZ? Okay, I'm just going to teach y'all for a while because y'all don't know shit on this. CTZ is the chemoreceptor trigger zone. It's located in the brain, and that's what makes you nauseated. So it stimulates that, okay? Serotonin will stimulate the CTZ, which stimulates vomiting. But this is a serotonin antagonist, so it's antagonizing that, so it'll decrease the vomiting. All right, side effects are kind of vague, like headache. And some people it can cause diarrhea. Some people it causes constipation. Some it makes you feel a little dizzy because it's operating on the CTZ. The only exciting thing about ondansetron is that it can cause QT prolongation, which we'll see on the EKG. It can also cause tachycardia, okay? If you're giving it IV push and you give it too fast, it can be ototoxic. So you just need to make sure that you give it really nice and slow. It can also cause torsades de pointe, which is a EKG dysrhythmia caused by electrolyte imbalances, okay? We do not want to give ondansetron to cardiac patients because it can cause torsades de pointe and QT prolongation, okay? We will give, if they're like, oh, I have a headache, we're like, okay, here's some Tylenol or something, okay? You're going to watch their EKG and their heart rate. Make sure that when you're giving it IV push or giving it IV at all, you're going to do it very slowly so you don't cause ototoxicity, and you're going to dilute it with 50 mLs of normal saline, okay? This is the best antiemetic for our chemo patients. You'll see almost every single chemo patient on ondansetron, okay? It is not effective, is more effective if you give it with corticosteroids. You will notice almost all of our cancer patients are on corticosteroids. It not only is an antiemetic, but it also makes the chemotherapy work better because chemo is a poison and it will cause a major inflammatory response in your body. So if they give corticosteroids, it'll decrease the inflammation. They can give more chemo, okay? Do not give ondansetron to patients if the electrolytes are abnormal, because if their electrolytes are abnormal and then you give them ondansetron, they're going to go into torsades de pointe, which is a dysrhythmia caused by electrolyte imbalance. Do we understand ondansetron? Yeah. Next one is promethazine. This is Phenergan. Y'all have heard of Phenergan before? You've probably taken it at some point. You can give it PO, IV, or as a suppository if they're not able to tolerate it PO. So if you have a patient that's puking, you can't be like, here's a tablet, right? So we would do a suppository. It is a dopamine antagonist. Where is dopamine made and absorbed?
The gut.
In the gut. It is an antagonist of dopamine, okay? We haven't had Neuropharm yet, but dopamine makes you puke. Dopamine makes you.
Puke.
Dopamine makes you.
Puke.
Thank you. So if this is an antagonist, then you will not puke. It is also an anticholinergic. What's your keyword for anticholinergic?
Dry.
It's drying, so it'll help to dry out your stomach, and then you won't get as much nausea. This one is a massive sedative, okay? Like Phenergan will knock you on your ass for about 12 hours. So yeah, you're not throwing up because you've been in a coma, okay? It does cause some dizziness and confusion because it's working on your dopamine, which is a neurotransmitter. It has anticholinergic effects. That means drying. It can cause hypotension. You will see this in Neuropharm that anytime you mess with dopamine, it's going to mess with their blood pressure because dopamine has a lot to do with our blood pressure, okay? Because dopamine is a neurotransmitter, this can cause EPS symptoms. What are EPS symptoms? This is a psych thing. Extrapyramidal symptoms. Y'all should all know this. This is psych drug stuff. Like major psych drug stuff. So EPS symptoms are abnormal movements. Okay? Like Miley Cyrus had it when she was like, you know, that's what they do. They do like weird shit. Okay? And they can't help it. What is tardive dyskinesias? Also abnormal movements. Yeah, but EPS you can treat and it's reversible. Tardive dyskinesias, if they get it from a drug, it will never go away, even if you take them off the drug. That sucks, really? Huh? Yeah. It can also cause NMS. What is NMS? If y'all are in here and you have had psych and you do not know these three, then you in deep shit. Okay, if you have not had psych, then you are off the hook, which is the only one person in here. That's you. Y'all, these three, I cannot express to you how much you have to know these for your psych class.
No, I know the
EPS, tardive dyskinesia, and NMS. That is neuroleptic malignant syndrome. That is a side effect of like every single psych drug.
What?
Neuroleptic malignant syndrome. Neuroleptic malignant syndrome is a side effect of psych drugs that causes you to have massive hyperthermia. So your temperature goes up very high. Okay. You will get muscle rigidity, which is always a giant red flag in nursing school. Okay. It is life-threatening. It can kill you. Okay. Marby, for those three, go through the psych modules. You've got to know those or you will not pass psych. Okay. But I definitely have these in the psych drugs and lots of other modules. Respiratory depression. So promethazine knocks your ass out so much that you can just, you know, stop breathing. It can worsen BPH. What is BPH? Good. Benign prostatic hypertrophy. So that's when the prostate enlarges. Anytime you dry out the prostate, it gets pretty pissed. Okay. And remember, promethazine is a anticholinergic. So your keyword is drying. So it's going to dry out the prostate. It'll make it worse. Where's the prostate?
It's above the bladder.
It's underneath the bladder and it wraps around the bladder neck. So if you cause the prostate to enlarge, it's going to cause urinary retention. Okay. Yeah. Do not use in kids less than 7 because you don't want them to be knocked out and have tardive dyskinesias for the rest of their life.
Is that the prostate?
Ma'am, that's a brain.
Oh.
Do not use in patients with glaucoma. Why would you not use with glaucoma?
Is it because of the IOP?
Yes, because anticholinergics, if you take an anticholinergic, those are drying agents, and glaucoma is increased intraocular pressure. So if you dry them out more, it's going to cause the pressure to go higher. Why would we not use promethazine with Parkinson's?
Because they already have tardive dyskinesia. Or no.
What is Parkinson's disease?
Involuntary movement.
But what is it? What is Parkinson's disease? Parkinson's disease is a neuro disease that is caused by a deficiency of dopamine. This is a dopamine antagonist. So if you're decreasing the dopamine and they already have Parkinson's, you're just decreasing it more and their symptoms are going to worsen. Obviously, we want them on fall precautions because they're not going to be able to move very well. Monitor the IV site closely because this one can cause, if it extravasates, it can cause massive issues. Watch the respiratory rate because promethazine can cause respiratory depression. You need to report any neurosymptoms or any abnormal movements. That could be either tardive dyskinesias or EPS symptoms. Okay. Increased fluids, artificial tears, artificial saliva because promethazine is a anticholinergic and that keyword is dry. You need to report fever or muscle rigidity. You'll need to get your red flag sheet out and write muscle rigidity. That is a giant red flag. It is never normal. That needs to be reported immediately. What does fever and muscle rigidity mean? What do they have?
Fever and muscle rigidity.
Mm-hmm. Get out your red flag sheet. Fever and muscle rigidity means NMS, neuroleptic malignant syndrome. It is an abnormal side effect of psych drugs that is life-threatening. It causes fever, high fever, and muscle rigidity to the point where they're going to get like rhabdo and an AKI. So it is life-threatening and needs to be reported immediately. Do you all understand?
Yes.
All right, next is metoclopramide. Metoclopramide, it comes PO or IV. It also is a dopamine antagonist, so just like promethazine that we just did. It is also a prokinetic. What does kinesis mean?
To move.
To move. What does pro mean? If you're pro something, then okay. So it promotes movement of the stomach. So it makes your stomach move. Okay. It is also a 5-HT3 antagonist. What is 5-HT3?
Serotonin.
So ondansetron was a 5-HT3 antagonist. Promethazine was a dopamine antagonist. They took ondansetron, promethazine, put them both together, and made metoclopramide.
Okay.
Okay, so you can see all of the side effects are going to be the same. Sedation, diarrhea, EPS, tardive dyskinesias. And that is a brain underneath, not a prostate, okay? All right, so what does metoclopramide treat? We use it for post-op nausea vomiting because it is an antiemetic. We can use it for our chemotherapy patients. We will use it for diabetic gastroparesis. What does gastro mean?
Your
Stomach. What does paresis mean?
To move. No, it stops.
Okay.
Paralyzes.
Yep, that is not paralyzed, but slows down.
Slows down.
Paresis means to like decrease, right? To slow down. So it in some diabetic patients, their stomach starts to slow down so much to where they don't actually even move food. That's a big deal because then they're going to start puking if you can't move your food. So you take metoclopramide, which is a prokinetic, and it will help to move your food. Okay. All right, GERD. It can also help to treat GERD because GERD can cause bleh. And also GERD is because sometimes you're over full, that sphincter will pop up and food comes back up. But if it's moving your stomach faster, it's getting rid of that food faster into the gut. Do not use in patients with Parkinson's. Why would we not use metoclopramide with Parkinson's?
Because it's a dopamine.
Parkinson's is decreased dopamine, and this also decreases dopamine. Do not use in kids. How come?
Don't want to risk tardive dyskinesia.
Don't want to risk tardive dyskinesias or the severe sedation. Do not use if a patient is already depressed. How come?
Because it causes depression.
It causes depression, and it's a serotonin antagonist. What's your keyword for serotonin?
Happy.
So if it's shutting down your serotonin, you're going to be even
sad.
more depressed.
Yeah.
Okay. Do not use if the patient has a bowel obstruction. Okay. Because it causes diarrhea and increases GI motility, which means you're going to perf that patient.
Okay.
Okay. Treat EPS symptoms with diphenhydramine. This is one of the most tested things you'll see in psych. If the patient develops EPS symptoms, what were EPS symptoms?
Extra paralysis.
That's NMS. EPS symptoms are those weird movements I showed you, right? They are reversible. You can treat them with diphenhydramine. What is diphenhydramine?
Benadryl.
Benadryl. Okay. All right. We're going to put the patient on fall precautions, obviously, because it causes dizziness. You want to give it 30 minutes before a meal, because what do you want it to do? Move your stomach. Okay. So do not give this to elderly clients. The last thing they need is sedation, diarrhea, EPS symptoms, tardive dyskinesia, and depression. Okay. Shockingly, this can be used in pregnancy, especially for like if they have severe nausea and vomiting associated with pregnancy. Do not give to a patient who has a hemorrhage or an obstruction or a perforation, because you're just going to push all their food and poop right out the hole. Do you understand?
Yes.
All right. The next one is scopolamine. Scopolamine. Anytime you see amine, okay, and I shouldn't say every time, but most times it's some kind of dryer upper. It's an anticholinergic, right? Because think of like diphenhydramine. That's Benadryl. It's a dryer outer, right?
It starts with the what?
S, scopolamine. You can give it PO, sub-Q. You can also give it transdermal. What's transdermal?
On the skin.
A patch.
A patch.
That's a patch. It is a muscarinic antagonist. So the word muscarinic is the same as cholinergic. It's a cholinergic antagonist, which means it's an anticholinergic. What's your keyword for anticholinergic?
Dry.
Dries you out. So we use this to treat motion sickness, especially if you go on cruises or something. If you've ever seen somebody with a patch behind their ear, that's a scopolamine patch. Okay. Suppresses the nerve conduction from the vestibular inner ear to the vomiting center. You have 2 vomiting centers in your body. One is in your ear, right? Just like we have a balance center in the ear. Where's the other vomiting zone?
In your.
We already talked about it like 5 minutes ago.
I thought it was inside your brain.
It is.
In the
CTZ.
CTZ.
Chemoreceptor trigger zone. Chemoreceptor trigger zone. Okay. So in this case, though, it's working on your ear. That's why the patch goes where when you're on a cruise? Behind your ear. It is an anticholinergic. What's our keyword?
Dry.
So you will see xerostomia, which means dry mouth. You can get dry eyes, constipation. What's my dryasis?
Dry.
That's the dry eyes. Yeah. And sometimes it can make you sleepy, just like diphenhydramine can. When you take Benadryl, you get sleepy. It can cause blurred vision because you can't see, can't spit, can't pee, can't shit. All right. That's why you also see urinary retention. That's the only one of these that is reportable. You're going to put the patch behind their ear, and then you're going to do the normal anticholinergic care, like increased fluids, artificial tears, artificial saliva. Make sure you wash your hands after you put that patch on, okay? Because if you touch your body in some place, like I've seen people do it to where they put the patch on, they didn't wash their hands, and then they kind of touch their eye. You do an anticholinergic, it'll blow your pupil, and then you'll think that you have like a brain bleed or something, and you're in the middle of the ocean. So it's kind of scary, you know? All right, do we understand antiemetics?
Yes.
All right.
So my dryasis, you said it's dry eye.